So our next candidate is Dr. Michael Weiss. Dr. Weiss practiced general pediatrics for 22 years and then served as Medical Director of Quality and Performance Improvement and Chief Medical Officer with Monarch Healthcare. He is currently the Vice President of Population Health for CHOC Children's Hospital and oversees the clinical program for 155,000 life pediatric group. He is past President of the Orange County chapter of the AAP and served as the Chair of the chapter's Committee on Fitness and Nutrition. Dr. Weiss completed his pediatric training at the Children's Hospital of Los Angeles and now lives in Orange County with his wife. He has 2 sons and 2 grandchildren. Please join me in welcoming Dr. Michael Weiss.
Good morning. All right. For those of you that thought you were going to a Chicago Bull or Chicago Bear game, I apologize. It's the best we can do here. So I want to thank the Academy and the National Nominating Committee for this tremendous opportunity. I'm humbled to be here, and it's been an amazing experience. I too want to thank Dr. Yasuda for this journey. He's been a gentleman. Obviously, his contributions to the Academy have been amazing, and again, I'm humbled to be part of this. So as I started to think about this discussion this morning, the first thing that really came to my mind was 7 minutes. What can happen in 7 minutes? And I want you to keep that in mind as we progress through this brief discussion. So let's go back 4 months. I've had the opportunity to visit with many of you across the country. Started in Southern California, went to Florida, we went to Denver. By the way, in Denver, just happened to be the birth of my second grandchild, along with my wife Lynn, who's out here somewhere, but our second grandchild in the entire district saying happy birthday to little George, so that was pretty cool. Go figure, George, right? And throughout all these district meetings, it became very apparent that there were 2 themes. Regardless of geography, there were 2 themes. First, I was very, very happy to see the engagement of the early career physicians. I was very happy to see the engagement of the specialty physicians. And I was happy to see the energy that was really generated by those frontline physicians. But the 2 issues that arose over and over were really very consistent. The first was assuring that we provide ongoing and continued access to the children of this country to high quality, timely medical care. And the second was really the issue all around physician burnout. And I think that those 2 issues fed very nicely into the 2 themes that I've tried to focus on throughout the last 4 months. And those 2 themes are really, first, translate, and second is nurture. So let me first address translate. Dr. Yasuda a moment ago mentioned, and I'll reiterate, the Academy has a wonderful blueprint for children that outlines very specifically how we want our legislative bodies to address various issues in pediatrics. In addition, there's a wonderful 1-year and 5-year strategic plan which very specifically outlines those issues that we want to be addressing in the short and long term. The challenge with that is how do we make it all make sense? We know what that's like. We know that feeling. So for one moment, just think about yourself in your office. You're looking out the window. You see that family where that bus pulls up, and it may have been the 3rd bus that family took to get to your medical center. And that child comes out with the family, and the child's in the wheelchair and may have durable medical equipment needs, etc. And you look out there and you see that family and you see what that family is going through. That's something we understand. It's not displayed in a strategic plan. It's not displayed in a blueprint for children. We have to tell that story. That's what we have to do. We have to take what we know is right and what we know in our heart needs to happen for the children of this country, and we have to translate that to the powers that be so that they can make those decisions. We need to tell the story. The second focus that I've had throughout the last 4 months is the word nurture. So bear with me, if you will. Take about 3 seconds, close your eyes, take a deep breath, and try to remember when you felt it. When did you remember or when did you know that you were going to be a pediatrician? Everybody got that feeling? So my question is, where has that feeling gone? We need to grab that feeling, that fireball that we all had in our guts 10 years ago, 20 years ago, 2 years ago, 30 years ago, and we need to grab onto that and we need to rekindle that and bring back that love for what we're doing. And how are we going to do that? The Academy can do a number of things. One of the things that we can do is to really help to nurture the passion. So many of you that are involved in the AAP, my guess is, much like me, you're involved in the AAP because you had a passion. And the AAP threw a little kerosene and a little match on that passion for you, and you were hooked for life. For me, it was fitness and nutrition. I had a catch grant, and I like to say that catch grant was more of a hook in my mouth that has never left. The second thing that we need to be really considering is how do we practice medicine throughout the day? And I mean that in a grassroots way. Rolling up the sleeves, what does it look like from the time a patient enters your office to the time a patient leaves your office? If there's anyone here who thinks there are no inefficiencies, I challenge you to raise your hand. I don't see any. Okay. So the bottom line is we have a great opportunity to, again, roll up our sleeves and to help our colleagues to be able to say, I can do these 3 or 4 very tangible things to be able to make my day better, to free up some time to allow me to do what I have to do. So again, feeding that passion and assuring the model works. So we are tasked with probably one of the most awesome responsibilities that one could have. People give us the responsibility of caring for their most prized possession. And I would submit to you that the way we are going to be most successful caring for that most prized possession is by assuring that those children have access and by assuring that our workforce is alive, well, happy, and putting a lot of energy into that. So what can happen in 7 minutes? 45 seconds to go. What can happen in 7 minutes? I would tell you that a senior senator can walk into the Senate and save Medicaid for children in 7 minutes. I can tell you that you can go to a quiet room in the middle of a very, very busy day and practice mindfulness in 7 minutes. And I will submit to you that those types of situations are what we need to keep pediatrics alive and well, and to keep the children of this country alive and well. I ask you to consider that I would like to help you make those 7 minutes a reality. I'd like us to look at those 7 minutes and make those 7 minutes make a difference for the children of this country, and I would be honored to be able to help you do that. Thank you very much.